Listen, I think the two of them will end up working that out together, where they want to go with the budget. And I'm not in those meetings, so I can't answer that question for you. But what I do think is there's not a whole lot of daylight between where we're going to go to fix this Medicare system. But what is clear is what the Democrats are trying to do. And the clarity there is that in Obamacare, to pay for it, the president and the Democrats have taken $700 billion out of Medicare, and they're using it to fund Obamacare. So our seniors have paid for a lifetime to fund their retirement in Medicare, and now those dollars are being robbed and put into Obamacare. We think that's wrong.
You're calling it robbery, but isn't it just a shift into much of the same way that the Ryan plan that you voted for twice also shifted some payments away from Medicare into from one part of Medicare to another part of Medicare?
No, there's no shifting. The Medicare payments go up year over year. What this does is take $700 billion out. And it uses it for a different set of people in a different program. And we don't do that at all. Don't come close to doing that. But I think what is interesting now is a lot of Americans are starting to say, hey, I haven't heard about this before. And that's because the liberal media has refused to ask that question. And I think what you're going to see is a greater conversation today about what Obamacare does to Medicare. A lot of people don't understand that there's the Independent Payment Advisory Board, a board of 15 unelected bureaucrats that are going to look at reducing reimbursements for Medicare. And if you pay less for those reimbursements, you're going to start to impact the quality and access to care for our seniors. That's the bottom line. And so as seniors wake up and say, hey, there are fundamental changes taking place to Medicare, and the Democrats have done it to us, we don't like that. But I do want to see a system that's going to be able to make Medicare work for everybody. And if you look at what Paul Ryan has put out there, it's a system that actually shores it up. It preserves and protects the traditional Medicare promise to our seniors, and it provides some reform for a future generation that makes the program alive and well for them when they get to their retirement.
But it changes the base way that we have looked at Medicare from being a defined benefit to a defined by the amount of money you put into it. And it relies upon the private sector of healthcare insurance. Now, let's say this plan goes through, you have a healthcare budget, and you now pass a voucher. What's to prevent the healthcare industry from saying, okay, each one of you, we'll take the voucher plus $1,000 more. We'll take the money that you are getting, whether you call it a voucher or whatever kind of payment you want to define it as, and you add $1,000 onto it. What is to prevent the health insurance industry from advancing beyond the money available?
So instead of using the Democrat talking point, it's actually premium support. And this future retiree, so someone who's 54 or younger, we'll talk about that person because, to be clear, if you're 55 or older, you get the traditional Medicare plan under what Paul Ryan talks about. Nothing changes. Again, there's no money that comes out. There's no iPad board. You get traditional Medicare. So a future generation of retirees, someone who's 54 or younger, they have an option. They can say, hey, I'm willing to stay in the traditional Medicare plan, or I can go into an exchange where I'm offered premium support and pick a plan or a plan or a program that works for me. Whether it's scaled down or it's souped up, I can get what works for my family and for me. So they have a choice. They can stay in the traditional Medicare plan, or they can go into this new proposal. But again, by doing this, you're able to shore up Medicare. You save it, you preserve it, you protect it. As opposed to right now, with the president taking out $700 billion, Medicare goes broke in 12 years. This is unsustainable. So if the president's own trustees in Medicare understand that it's going broke, why isn't he doing anything to fix it? And why is he taking money out of it? That doesn't make sense, does it? If this program's going broke and you made a promise to your seniors, why would you take money out of Medicare and use it for somebody else when it's going broke? That doesn't make sense to me. And I guess I haven't heard any of the Democrats answer that question.
But Congressman, you didn't answer my question, which is essentially, would there be any controls upon the profit taking of insurance companies that will register people under this program as proposed by Paul Ryan?
Well, listen, will there be insurance companies involved? If the people choose that option, they will be. But here's the deal. We believe that competition works. Choice works. I believe that if I empower a consumer to pick a plan that works for them, as opposed to a set of bureaucrats in Washington deciding what kind of reimbursement we get in Medicare and who's going to have what reimbursement lowered per the IPAB board, or bureaucrats taking $700 billion out of Medicare. Listen, I think it's a far better choice to empower the individual instead of the bureaucrat in Washington, and that's what Paul Ryan's plan does.
Well, there's been a lot of competition in health insurance and other insurance industries, and we've not seen the rates go down at all. How can you be sure that that under the plan that you're espousing here, that there would be competition to reduce the rates, or that would be anything other than just keeping on the inflation that benefits the insurance companies?
So if you go buy a lawnmower, go to the grocery store right now, or the hardware store and buy a lawnmower, do you know what you're going to pay for when you go to the checkout?
Yes.
If you go to a colonoscopy today, you know what you're going to pay for it? You have no clue. The market right now doesn't work in healthcare. So don't tell me it's a market that works. And so what I put out my own healthcare reform plan that deals with price transparency, competition across state line, tort reform, making sure people that have pre-existing conditions can get healthcare. But this is not a market that actually works because people can't shop on price and service because they can't get that data. That is contrary to everything else we shop for. But you talked about healthcare costs going up, didn't you? And if you look at healthcare health insurance costs, since Obamacare has passed, the average family has seen a $2,000 increase per year in their premiums. So the president promised us healthcare costs would go down, health insurance costs would go down, and they've actually gone up. Just another example of a promise that was made that wasn't kept. And so I do believe we need reform. There's no doubt about that. That's why I put my own ideas on the table. But let's not make any mistake in regard to Medicare, what the two sides are doing. There is only one side that is taking money out of Medicare that was promised for Medicare and using it for someone else, and that's the Democrats. There's only one side that set up a ration board, which is the Independent Payment Advisory Board, where political appointees are empowered to reduce reimbursements for our current seniors, and that's the Democrats. The only party that's saying if you're 55 or older, there is no changes. You get exactly what you bargained for. People retired based on this promise. They deserve to get that promise. And we're going to fight to make sure that our seniors get exactly what they bargained for.
But then, like I said, then again, though, there's no cost controls on what the insurance companies make. Well, let's take a look at the Affordable Care Act that's been put in place. There was a provision in it that said that 85% of the money going to insurance companies would have to be shown to be being paid out in patient expenditures. Would you support something like this be a part of the Romney-Ryan plan?
You talked about cost controls.
Yes.
First of all, do we have cost controls?
Cost allocations more than cost controls.
Listen, do we have cost controls on lawnmowers?
No, we don't. But a lawnmower is different from a heart surgery.
No, because you have competition, and so if you have competition within the plans that you have the right to purchase in the exchange of Medicare, we believe that competition drives prices down. And when we see markets work in competition in any sector of the economy, we see higher quality and lower prices. And that's what we're advocating for within healthcare. Price transparency, competition, and when you have that, and you empower the consumer, you empower the individual with information to go in and buy a product that works for them, we see the end result far better off for the consumer. And that's what we're advocating for. And I do have to run, but I thank you for your questions. Thank you, guys.
Do you have any quick questions for me? How much are we going to see you in Hudson?